you're going to hear from 3 mothers who are having autistic children and very good professional doctors, 2 of them.
So maybe I can start as a parent, and I know most of us parents here would be wondering, especially parents from Africa. So we're wondering, what are the more advanced interventional therapies, across the world? Because in Africa and in Tanzania, to be more particular, we're already used to the normal basic therapies. So we would like to know from you, doctors, what are the more advanced, intervention therapies out there?
Yeah.
Thank you, Sarah. So, I think you want to know about the rehabilitation therapies.
Exactly.
So, as we know that the pillar stone or the basic conventional treatment for autism is neurorehabilitation, and that's the foundation on which the whole treatment for autism or cerebral palsy or intellectual disability basically leans on. So, of course, all of you know about occupational therapy and speech therapy, and we also do physiotherapy as well as special education and ABA therapy. So these are very important and have been tried and tested for many years now. But what we also have, especially in India now, we have aquatic therapy. So aquatic therapy is, children love water, right? So basically if you make them like swim in water or do specific therapies in water, they calm down better and it helps them concentrate better, their coordination improves. So coordination is one of the major issues in children with autism. So aquatic therapy has a big role to play in a comprehensive part, as being part of a comprehensive treatment for autism. Apart from that, of course, sensory integration therapy. We are aware of sensory integration therapy as a part of occupational therapy, but it's a science in itself because the information processing is a problem in children with autism. So sensory integration therapy, then art-based therapies, animal therapy. I think it's a beautiful therapy. Children are very sensitive and the animals are so sensitive, like we have trained dogs, and horses are a very good medium who sense the children's despair or their moods very well and help them settle down, and they work together beautifully. So animal-based therapy has come up as a part of, as one of the treatments for autism. So what we believe in India and in Neurogen is that it's important to do teamwork. So everyone working separately, you will achieve a little bit, but when you work as a team, together everyone achieves more. So comprehensive holistic rehabilitation, which happens together under one roof, would be the ideal situation to get treatment for children, and especially parents understand the importance because they are going from one place to another to get rehabilitation from different people, trying to squeeze in everything in one day. So comprehensive holistic rehabilitation under one roof which combines conventional rehabilitation with advanced rehabilitation treatments like aquatic therapy and sensory integration therapy, along with ABA and speech and special education and art-based therapy and animal therapy would be the best combination, we believe.
Thank you very much.
Thank you, Dr. Nandini. That was very well answered. But to answer your question, what is required, as Dr. Nandini said, is comprehensive rehab. In autism, the children require occupational therapy, speech therapy, behavioral therapy, psychological therapy, special education, art therapy, aquatic therapy. They require a combination. What happens in most parts of the world, you will have an occupational therapist who will only give occupational therapy. Then you have a speech therapist who will only give speech therapy. And they don't work in isolation. What we've realized over the last 15 years of working in this field is you need a combination. So there is a need for centers where all of this can be provided together. Honorable Mr. Mulil was asking what we can do from a district level. What is required is facilities where all these therapies are available in one place. Also, when we are looking at this, we should not look at urban areas only. We have to think of the rural areas as well. And in India, what we have found is one of the best ways to work on this is to train the local village workers, local workers. They may not be professional rehabilitation therapists, but they will provide the basic care, that is needed. So a structured rehabilitation program which has all the specialities is the need of the hour. And the important thing in this is this does not require infrastructure or money. Okay, this requires trained therapists. And we from our side, we offer, and I'm making this open offer, any therapist from Tanzania, Kenya or Uganda wanting to train in these rehabilitation therapies, we offer free education and training to all of you. So if all of you, and we have regularly been doing it over the last 15 years, people from all across the world have come, and we offer this completely free of cost. You're welcome to come to us. We will train you, because rehabilitation is human based. It's about people, it's about training, and we are able to offer that. So any of you therapists here, should you ever wish to come, please contact us and we will arrange your entire training program. To Honorable Minister Mulel, if you, as a government, if you send people, in any case, Tanzania and India have a wonderful relationship. Historically also, many people from Africa have actually trained in India, you know, from the administration, civil services, military. We have a very good education, and we want to continue with that. And we will offer training, comprehensive, very good training at no cost at all. So this way we can improve the basic of this thing, and we are also willing to conduct training programs here. We've already conducted several training programs. We've conducted in Kenya very huge 1-week programs where our people, so in case it's not possible for people to come, we come and train again at no cost at all. From the actual practical training, we give literature, books, lectures, and make it a very comprehensive program. So that, I think, will be part of our Tanzanian-Indian partnership as we go ahead.
Thanks very much, Dr. Sharma. I think, one, I like the assurance that you can train, your institute can train our therapists. I think that's very positive for us as parents and as professionals. Thanks for that. And I'll ask Madam Kate to go.
Yeah, me as a parent, I already know like what are the autism physical symptoms. Like my son would run around the whole time, like flapping hands or having repetitive behaviors, playing with kids and all that. Do we really know what is happening in that child's brain? Is there any way you can tell us how can we know what is happening in this child's brain?
It's really important because so many parents come to us and say, oh, my child looks absolutely fine. What exactly is wrong? You know, people say that there is something wrong in the brain, but how do we know? The MRI, most times MRI is not done, and even if it's done, the structure seems to be fine. So at Neurogen, we went ahead and actually looked at really what is wrong in the brain, and this was done through functional imaging. So advanced scan imaging known as a PET-CT scan of the brain, which tells us about functioning of the brain. So structure-wise, everything seems to be fine, but when we look at the PET scan images, we find that there are certain areas of the brain which are functioning less, and that is indicated by, which is very easy to read, made it easy to read through a color spectrum. So we were explaining to the Honorable Deputy Health Minister also that, you know, when you look at the brain with those different color schemes, you see that there are green, lighter brain, green, yellow and red, which are normal functioning brain, but deeper parts, which when we say out and we think about what do they do, it correlates beautifully. So the small part of the brain, and one of the speakers yesterday actually mentioned that the cerebellum, the back of the brain, which is important for coordination, balance, articulation, chewing, integration of functions and movements and tone, is working less, and you can see that in the PET scan. The deeper parts of the brain, known as the medial temporal, which is responsible for understanding, learning, comprehension, socialization, emotional expression, this is working. And the middle part of the brain, which connects two brain known as thalamus, which is a relay center, is working less. So all of this is possible only through the PET scan. So through the PET scan, we can actually find out which parts of the brain are working less, and now we get an understanding as to why our children are unable to process information or unable to respond to a lot of training that we do. So advanced imaging has really helped us go deep into a better understanding of what is autism and what really is functioning less and what is lacking in the children.
So to continue with what she said, there is new brain imaging technology, and here I will have to keep talking back to Honorable Minister Mulel that we will need this equipment in this country. This is an equipment called PET CT scan. I'm not sure if it's available. It may be available. This is modern functional imaging, which actually tells us which parts of the brain in children with autism are not working. So if it's there, that's great. We can actually start, investigating and looking at our children. But what is functionally, as Dr. Nandini said, has been found. So if I were to divide our brain into an upper brain or a higher brain, which does the thinking, the intelligence, the executive function, and all of that. And then there is a little lower brain, the smaller brain called the cerebellum and the medial temporal brain. This is responsible for the primitive instincts. This is responsible for, the basic reflexes that we have. Now, what we have found in our research, and we were the first to do this in the world, and we've published our work in a very prestigious journal called the World Journal of Nuclear Medicine. We have for the first time shown the world that there are parts of the brain that are what is called hypermetabolic or not working properly. And this corresponds to the symptoms. So now for the first time we know why our children cannot talk, why they cannot read and write, why do they have all the behavioral issues, why can't they make eye contact, why can't they, take care of their daily activities like, brushing, bathing, food, etc. Why can't they process information and comprehend? Because there is a part of the brain that's not functional. For example, let's say if any of you developed a fracture of your leg, would you be able to run? Would you be able to walk? You would not be able to stand. It's not your fault. It's just that if your leg is fractured, you can't walk, run, and move around. But if your fracture was fixed, now you'd be able to walk. Now, this also answers a question that many parents have. Many of you will say, we have done all the rehabilitation possible and still our child is not improving. Okay, are there parents who will say that? There are parents who will say that, right? That we have done all the rehabilitation possible, our child is not improving because presently we are doing rehabilitation on brain that is not functional so much. But now there are medical technologies that can actually help improve this function. So understanding is the first step towards getting a solution. And today with the brain, the understanding comes from modern imaging techniques which include PET CT scan, MRI, EEG. MRI and EEG is available easily. But a combination of this gives us an insight. And once you have an insight into the problem, now you can find solutions.
Thank you so much. I think that's wonderful. I have a question as you speak.
Okay.
So there is this brain, you've done your imaging, you've done the PET scan, you found there's something in the brain. I've heard there are new treatment modalities, hyperbaric oxygen, therapy, ozone. What is the role of those treatments in either treating or alleviating the symptoms of this brain?
So what brain imaging has shown us is there are parts of the brain of these children which have what is called hypoxic ischemic damage. That means this brain is not receiving enough oxygen. Now, if the brain is not receiving enough oxygen, then obviously one possible solution is to give it oxygen. But just giving normal oxygen does not help. What we have found and what medical science has found is you have to give oxygen under pressure. So right now, we are breathing oxygen at 1 atmospheric pressure, all of us. Okay? And when you breathe oxygen at 1 atmospheric pressure, only the red blood cells in your body carry the oxygen. In our blood, we have got red blood cells, white blood cells, and a liquid called plasma. Right now, all of us are breathing, only our red blood cells can carry oxygen. The liquid of the blood has no oxygen. But when you give oxygen under pressure, like 2 atmospheric pressure, now the oxygen goes into the liquid. Okay, so right now in our body, only our red cells are carrying the oxygen. When you give it under pressure, the entire blood is carrying oxygen. So much more oxygen reaches deeper parts of the brain. It goes to every part which may be possibly hypoxic. So there is this new technology called hyperbaric oxygen therapy. This is available, I'm not sure whether it's available in Dar es Salaam, but I'm sure it's available. It's normally used for wound healing. So far hyperbaric oxygen has been used for wound healing. But what we have found is when we use it for oxygen, when we use it for autism, sorry, there are significant improvements, especially when we combine it with many other treatments. So there are a lot of scientific publications that actually show the benefit of this. All this requires is a hyperbaric oxygen machine. It's not very expensive and it is very, very simple to maintain. Most government hospitals, medical colleges do have hyperbaric oxygen. The only thing is they use it for adults. We have evolved a protocol for children, and we have successfully used it in several thousand patients. So we have this unique protocol where children with autism can be helped as well.
Thanks. And is there, I'm asking as a parent, I know it's given in a chamber and sophisticated, environment. Is there a provision for a home-based hyperbaric oxygen?
Yeah, so you do get home-based. The oxygen therapy we use, they are called heart chambers, where the pressure goes up to 2 atmospheric pressure, double of what we are breathing. You can get home chambers, but there the pressure goes up to 1.3 only. So it is a little better than what we are breathing right now, but not as good as medical hyperbaric. Also, those soft chambers are extremely expensive, and then once your child is finished, you don't have any use for that. But you can give home hyperbaric, but the pressure is much less. It's 1.3, whereas we need between 1.8 to 2.
Okay, thank you. Thank you very much.
Dr. Alok or Dr. Nandini, the ozone therapies and the HBOT therapies, that is hyperbaric therapies, they make a lot of sense to me as a parent because I've gone through that. Can you explain to us or to parents more about the regenerative medicine or the cellular therapy, and how is it effective to autism and other neurological disorders like cerebral palsy or stroke or any other neurological disorder?
So basically, the human brain is the only organ which on its own does not regenerate. What do I mean? Suppose your skin is cut. A doctor can take a stitch and your skin joins. If your intestines are damaged, you can cut it and stitch it. You can stitch the heart, the kidney. You can fix a bone. But in the brain, you cannot take a stitch. You cannot suture it. So all these years, for the last 150 years of modern medicine, it was believed that the brain is incapable of regeneration. Because till then, we had only 2 kinds of treatments. Either we had medicines like a drug or an injection or tablet, or we had surgery where we went inside, cut, chopped, sutured and closed. There is no medicine and there is no surgery for autism. However, the last 25 years has seen the evolution of a new kind of treatment, which is not a drug, which is not a surgery. It's called cellular therapy, where you use healthy, good cells to repair damaged cells. For example, if suppose you get a cut on your hand, what happens? That wound heals by itself, right? That wounding is called biological healing. So now it is possible to repair damage in the brain through cellular therapy. So where do we get this from? What we do, there are 2 kinds of cellular therapy. One is when you take from the child's body or from the patient itself and put it back in the patient. And the second is when you take it from a donor. So there are 2 completely different types. Now, the treatment that we do, we take from the patient or from the child. And what we do is, just above the hip bone, there is something called the pelvic bone, where we put a needle and we take out the liquid in the needle that is called bone marrow. It's a very simple process. It takes 15 minutes. The child is given local anesthesia and sedation, so the child experiences no discomfort. Once we take out this bone marrow, we next take this to our laboratory, and from this bone marrow we sort of filter it and separate it by putting it in machines called centrifuges, and then we isolate or separate the cells that we need, that are in general referred to stem cells. What we do is we use what is called mononuclear cells. So we have taken out, I'll repeat again, we've done a bone marrow, 15-minute, just like how you collect blood, right? You put a needle into your vein and collect blood. Likewise, we put a needle into the bone and collect bone marrow. It's just a collection. We have taken this to our laboratory. Now we've separated the stem cells. And then once the stem cells are ready, this takes about 3 hours. Then we call the child back to the operation theatre, and we make a needle puncture in the lower back. Why the lower back? Because in the back, our spine has got a fluid called cerebrospinal fluid, which circulates from the back all the way to the brain. So it goes to the brain, comes down. It's a continuous circulation between the back and the brain. So when we inject the cells into the lower back, into the fluid, within minutes it goes up to the brain. Once it goes up to the brain, the damaged areas, they pull the stem cells towards it, and once the cells are taken towards it, they start the repair process. Stem cells are known to multiply, they divide, and they convert into neural cells. And we have done all this, between 1998 to 2008, for 10 years, we did work in the laboratory, and we worked with animals. And we first showed and proved that these stem cells can convert into neuron cells and that they can repair the damage. So in this whole treatment, if you can see, there are only 2 needle pricks. With one needle we take out, okay, then we separate the cells, and then with a simple needle we inject it back. And what are we injecting back in the child? The child's own good and healthy cells. There is nothing from the outside. There is no chemical. There is no any artificial thing. There is no donor cells. So we are taking good healthy cells from the child, putting it back into an area where it is needed. So it's a very simple process. Did you understand the process? I can repeat it. A simple needle into the pelvic bone, take out the bone marrow, takes about 15 minutes. Take the bone marrow liquid, take it to the laboratory, filter it, separate the stem cells, and then call the child back and inject with a very thin needle into the lower back spinal fluid from where it travels to the brain. So the beauty of this treatment is it is so simple. It can be done anywhere. It's not complicated. It's not like the major, I'm a neurosurgeon, I do brain tumor surgery, spine surgery. That's also complicated. Takes hours and hours. You go and open the skull, go into the brain, do things. It's nothing like that. 2 needle pricks is all it requires. And we are using our own good cells and putting it back in the child. So we now have a clinical experience of more than 13,000 patients. People from all across the world, more than 100 countries, actually from 102 countries have come to us. And several patients from Tanzania, several patients from Africa. And with this treatment, we are able to repair the damage, and we have proved it in 2-3 ways. One, after the treatment, the child starts improving by itself. The understanding improves, the comprehension improves, the behavior improves, the eye contact improves, they get back their speech. Several of our children are able to go to schools. Many of the kids we have treated several years ago, they have not only gone to regular schools, but they have graduated. Many of them are now doing jobs. So they become completely independent. So our kids, in a few years' time, go off the spectrum. Why? Because now we've repaired the basic damage in the brain. Once the brain damage is repaired, now they are able to integrate and get into a normal life. So that is broadly what stem cells do. Did good. I tried to make it as simple as I can. Yeah.
Thank you very much. Sarah?
Yeah, thank you, Dr. Alok, for the detailed explanation. But I'm sure many parents here will be wondering, because we've heard a lot of things about stem cell therapy. How safe is it? And are there any risks behind it?
So that's the most wonderful thing about the treatment. It is 100% safe. You know, why? Because we are not operating. We are doing just 2 needle pricks. With one needle we are taking out, with one needle we are putting back, and we are using the child's own natural healthy cells and putting it back. So there is no danger or no risk. Now the only possible risk, and we have published this as well, is in children who have epilepsy. Epilepsy is convulsions, you may be aware, where there is a past history of epilepsy. In 3%, it's a small ratio, but it's 3% of the children can develop epilepsy after the treatment. But if it does happen, it is treated with medicines and it can be controlled. This risk is not there in children who don't have epilepsy. So in children who have epilepsy, there is this 3% possibility. Otherwise, it's a completely safe treatment. We have a 0 risk of infection. We have no patient so far who's become worse than what they were before. As a parent, your main issue will be, my child should not become worse than what he is. So about that, I give you an absolute guarantee. And they're very strong words. A guarantee that a child will not become worse than what he is. He will not lose any skill that he already has. He's only going to improve.
My question following that, again, thanks Sarah for that excellent question. I think that puts a bit of anxiety down. But in what age groups do you get the best results? Or who is the youngest patient? What's the age of the youngest patient you've developed with, you've dealt with? But also I want to know what age groups we should be targeting to make sure we maximize the benefits of stem cell.
That's a very, very good question. So what our research finds is that when we treat children below 5, they have the best possible results. Now here there's something very interesting, you know, we have a doctor from Kenya, from Nairobi. He's a pediatrician, and what he does is the moment the patients are diagnosed at 2 years, okay, he sends all the patients to us for treatment at 2 years. And we will be able to reverse the autism in all of them because they've come to us very early. What our own research shows is that the earlier you treat, the better it is. Now the thing about autism is you don't make a diagnosis till about 1.5 to 2 years. So our youngest child is 18 months. We have several children we've treated at 2 years, 2.5, 3 years. We've also got children we've treated between 5, 10. The oldest I've treated is a 38-year-old boy. So now there is a wide range, but like in any other, you take any other disorder, any other, what we don't consider autism a disease, by the way, so I don't want to compare it, but any other disorder, the earlier you treat, the better it is. Okay, if you have diabetes and you start exercising and shift your diet, you can cure it without tablets or insulin. But if you start treating it late, then you need insulin. All right. The same thing is true of all diseases. The earlier you treat, the better results you get. And here is the problem. Everybody keeps saying to wait, you know, that wait till this treatment is more established. But the longer you wait, the lesser results you get. And the results of this doctor, this wonderful gentleman doctor from Nairobi, has clearly shown, and he's actually analyzed the data. You send children at 2 years and you can almost completely reverse the autism.
Thank you.
Let me ask, you're talking about a doctor from Nairobi who sends patients as young as they are 2 years old. Why is it that we go to some clinics or some therapy institutions and we find that stem cell is not recommended?
Okay, that's a very interesting question. See, I'll tell you, and I say this openly, I don't mind saying it, all of us in Asia and Africa have what I call a colonial hangover. They're very strong words. What do I mean by that? When a doctor from the Western countries, from America, England, with a tag from Harvard, Oxford, Stanford comes, all Asian and African doctors start believing in them. All right? But when work comes from Asia and Africa, we don't believe in our own people. Now, stem cell therapy has evolved in the East. So India, China, Korea and Japan, we are the leaders. Okay? Japan and China have, Japan has almost 900 stem cell clinics, China has over 1,000. So these are, I'll repeat again, India, China, Korea, Japan. The Western, in this particular thing, so the world's first scientific paper on cell therapy in autism was published by us from India. The second paper came from China. The third paper came from Italy and Ukraine. And the fourth and fifth paper came from America. This is a race that India and China have the gold and the silver. The Americans don't even have the bronze. They are fourth and fifth. I'm just in a lighter way. So our own doctors don't believe in it because they say, why is it not coming from the West? Okay. So this is the fundamental problem, is because this is an Eastern-driven technology for various reasons. There are political reasons, there are religious, there are several reasons due to which it didn't develop in the West. It developed more in the East. But now the West is trying to catch up. So in America now, at various universities like the Duke University and several other centers, they've now started doing it. But they are 15 years behind us, 15 years. So once now they start doing it, trust me, your own doctors will start recommending. Once the results start coming from America, they will start believing it. There are a couple of other reasons as well. One of them is that a lot of developments in the medical world are driven by the pharma industry, big pharma. We know that. We saw what happened in COVID. It was, the big vaccine companies and all of that. Now, the treatment we do is not supported by big pharma because they have nothing to gain. In fact, they believe they have everything to lose. So the CEO of one of the biggest multinational companies told me, Dr. Sharma, you are an existential threat to us. I said, why are you saying that? He said, if you make everybody okay, who will take our medicines? Do you understand? Right now, children with autism have to take a lifetime of drugs. A lifetime of drugs for hyperactivity, for so many issues. When we treat them, they stop taking the drugs. So do you think the pharma industry is going to back us? They will not. Like the words he used, it's an existential threat. Right? So I'm not saying they're actively opposing it, and sometimes they do actively oppose it, they do a lot of things, but it doesn't have the support. So in various medical conferences and things, if the pharma companies are backing it, they won't even permit lectures on stem cell therapy. So these are a couple of the reasons. One, it's East-driven, and second, it doesn't have backing from big pharma. Did that make sense?
Thank you so much. And again, following that, the big pharma, I've heard that the US Food and Drug Authority has not yet approved stem cell therapy. Oh. Is that so? And what have you done about it?
That's very interesting. Because, like I told you, stem cell therapy has got autologous as well as things which are manufactured by companies and sold as donor. In August of 2022, a district court in the United States passed a beautiful judgment which actually said that when you take from the patient and put it back in the patient, you do not require FDA approval because FDA is Food and Drug Administration, and when you take from a patient, put it in a patient, it's not a food, it's not a drug, it's a procedure. So a federal court in the United States told the FDA that you have no jurisdiction over procedures. So now the whole question, it's not US FDA approved, is an irrelevant question. I'll give you another example. It's like the difference between you take an orange and make homemade orange juice, or you make canned juice, Tropicana, or whatever you get here. Okay. Now to sell Tropicana, you need permission, right? You can't go through without. But to make homemade orange juice, you don't need permission. Right? Do you need permission to make homemade orange juice? So when you take from the patient, put it back in the patient, our Indian courts have said that. In 2019, our Indian High Court said that only for stem cell derived products when you're using, you need a license. That's, the words were stem cell therapy is permitted. And a recent court judgment, because there are people who oppose this work. Just 1 month ago, they actually specified for autism. And the High Court of Delhi and the Chief Justice gave this judgment, said that this treatment cannot be discontinued. Okay, and actually spoke of patient rights. So in India, fortunately, our government has made this distinction very clearly. The equivalent of our FDA has said very clearly, if a company manufactures and sells something to doctors that is a product, it requires a license, like you require a license to sell canned orange juice. Our government says if you're a doctor doing it in the hospital, You do not require to take permission because it's a procedure. Procedures don't have an approval pathway. A product has an approval pathway. They are two separate things, a product and a procedure. So this is something which the Indian courts, the Indian government has said for a long time. Now the American court has also said the same thing. It is here that national leadership makes a big role. For example, our Honorable Prime Minister, Sri Narendra Modi ji, he is a big supporter of stem cell therapy. When he became Prime Minister, in his first address to Parliament, as to what his government will do, they included 5 areas where they will focus on research, and one of them was stem cell therapy. The other was nanotechnology, thorium research, but one of them was stem cell therapy. When he went to Japan, Honorable Prime Minister Sri Narendra Modi took time off and went to the stem cell laboratory of Professor Yamanaka, who won the Nobel Prize for his stem cell work. We are very fortunate and blessed that the Honorable Prime Minister Sri Narendra Modi ji has written a personal introduction for a book that we have authored. There's a book that myself and Dr. Nandini have authored on a disease called muscular dystrophy. And Sri Narendra Modi ji has written an introduction for that book. So what happens is, when you have the national leadership on top supporting something, it gives courage to the doctors to go ahead and practice it. The Honorable Health Minister Mullen was asking what needs to be done before the equipment, before the infrastructure. The government has to make policies and rules, and we'll share with you some of which are there from our country, so that other doctors have become comfortable in doing this. Then there is, of course, need for awareness. Then, of course, there is infrastructure, and then there's training. And like I said, training is something we offer at no cost at all to different. We already do it. We already do it for people from different parts of the world. Another thing, since we mentioned our Prime Minister Sri Narendra Modi ji, he did something very, very interesting. There was a word for disability in our Indian language that was Viklang, which translated meant disabled, unable to do. It is a negative term. Viklang means you cannot do, somebody who cannot do things. And he officially changed the local word for disability from Viklang to Divyang, which means specially gifted. So officially in India now, you cannot use the word Viklang, which had been used for the last 100 years. You have to say Divyang, which means specially gifted. Now, in this one simple change of words, the Honorable Prime Minister has shifted the focus to what these children can do and not what they can't do. Now, this is so important because this change in mindset, and this comes from the top. When it comes from the top, it percolates down. It gives inspiration and motivation for people to get into the field. It gives inspiration for people to set up rehabilitation centers. It gives motivation to set up special schools. Because the rate at which this autism is increasing, we will have, like it was mentioned I think Sarah, you mentioned in your talk, the most accurate figures for autism come from America, from the US CDC, which says that 1 out of 36 children have it. Last year it was 1 out of 44. And before that it was 1 out of 53 or something. And before that 1 out of 66. So if you read, and these are not our figures, the US CDC's figures. The graph is going up like this over the last 10 years. By this ratio, next year it will be 1 in 15. And the year after that it may be 1 in 5. These are the most accurate figures in the world. We are not aware of it. There is I don't know what to call it, a pandemic, endemic, what, of children suffering with autism and other neurodevelopmental disorders that will hit us so badly because we do not have the infrastructure for it. And here, governments have a role to play. So again, one more thing, since I keep talking of our Honorable Prime Minister, and this is something I'll share with you, you should please study this bill. He passed a law called Rights of Persons with Disability Act in 2016. It's a wonderful bill. In that he's listed 21 disabilities and has clearly, by law, by an act of parliament, mentioned a whole lot of privileges and rights that parents have. For example, one problem you must have faced is normal schools do not take your children for education. Is that correct? Yes. I'm sure all of you have experienced that. You go to a normal school, they say, we will not take this child. By law, our Honorable Prime Minister said, no school can refuse a child with autism. It is the responsibility of the school to arrange shadow teachers or other special. So all schools by law now they cannot say no. So again, all this comes top down, right? We can work and we can work in the environment, we can put in hard work, we can slog, we can do everything. But once you know that your government, has their hand above you, then we can go the extra mile, we can do whatever else, and there will be opposition. The work we do has a lot of opposition, a lot of critics, a lot of vested interests have tried to shut us down. They've made all attempts to shut us down. But again, at the higher level, when you have a support, you keep going on. So that's a long question to a short answer.
Thanks very much. Again, I am representing parents, the majority of the parents, but I also happen to be a professional. I have two questions. One is to the government. I think in East Africa, maybe I would speak for East Africa that I know most, we do not know the magnitude. We do not know how many people are living with autism because we haven't done the researches that document those figures. It's only a few of us that can come out and say we have children living with autism, but we do not know how many out there they are. We'll advocate as parents, we'll come to you and knock at your doors. We need to carry out this research to know, because like they said, it's a pandemic, but we don't even know what we are talking about. We need funds, we need a budget aside to get into the nitty-gritties and know how many children we are planning for that are living with autism. That's not a question, it's a plea to the government. My question is, as a mother with a child on the spectrum, I take my child for treatment and the child is, given whatever they are given. But as a mother, I think I'm more autistic than my child. I have the worries because I understand what autism is. And I worry about the future of this child. Do you have anything for us as parents to also manage those symptoms that we display of anxiety, of depression, of hyperactivity? Because when you go to a hospital, I can tell you some of the parents will slap the doctors because they are frustrated and angry. Do you have anything for us or any advice for us as parents? That's one question. I'm happy you're clapping for me because it's been a journey. You actually, even when you go to church and your child is discriminated, you're angry and frustrated and rude. Then the other is, what is my role in all this you're talking about as a parent in the management of this autistic child?
Okay, I think that's the single most important question you've asked, because you are asking what is the power within parents, what can you do at home? And I think that's a very, very important question. So let me start with, there are going to be multiple answers to this, Dr. Olivia. First, I want to appreciate and thank you for coordinating this, because you are a parent as well as a doctor. That's why I think they've decided to keep you in the middle. You have parents there and doctors here. But I want to talk about several things. So first thing, there is actually research that has happened in India which has shown that every mother, especially mothers of children with special needs, go through depression, anxiety, and severe psychological upheavals. Many of them even contemplate suicide. We've had several mothers who've actually not just thought of, but attempted suicide, and not just once, 2 or 3 times. And whereas for others, they may not understand, I think as mothers, you will understand why a mother would want to commit suicide, because it's just so difficult to handle. Now, the thing about autism is it's called the silent disability because you can't see it. The children look normal, right? They look normal, and so, but looking after them day to day takes a lot of spiritual, emotional, physical courage and efforts. Right from morning, from getting them up to getting their basic toilet and clothing, to feeding them, to taking them to rehabilitation centers, everything is such a challenge. It's not like, you can just walk across. It's like you're walking across with a haversack and 2 heavy bags. Everything is a challenge. Everything is difficult. Every single step. And I very often say, as mothers of kids with special needs, you put more emotional and spiritual energy in one day then maybe most of us don't put in a whole year just to see one day through. So yes, it takes a lot of energy, devotion and concentration. But one of the reasons for that, and I'll tell you the reason for that, is all of you, when you've gone to your therapists and doctors, they've told you that nothing can be done for your child. Haven't you been told that? All the doctors said nothing, you have to live with this. And what can be more depressing, what can create more anxiety or more depression or more fear and anger than being told, here's this lovely, cute, beautiful child you have. The whole world has advanced so much in science and technology. We are sending rockets to the moon and Mars. Then why can't my child be helped? Okay, so that is at the bottom of your frustration, anger, hurt and pain. And here I am to give you good news that that's no longer true. Okay, today we have medical science, medical technology that can actually reverse autism. We've treated several thousand children of that. Our work is published in scientific papers. So today there is technology available. It's not available in Africa, but it is available outside, and I'm sure soon with the support of the Honorable Minister and other senior people, this should be available here as well. So earlier, if you were in a dark tunnel with no light at the end, now there is light at the end of the tunnel. And once there is light at the end of the tunnel, a lot of your anxiety and depression goes away because now there is something you can work towards. So that's the first good news that we have to spread. The news that autism cannot be treated is a 50-year-old, 75-year-old myth which is no longer true, because we have shown, we have proven through having treated thousands of patients and our scientific publications that this is no longer true. Now, a few things I must tell you from what we have learned from, by the way, we learn much more from parents than we read from any book. So we've been doing this work for the last 15 years. We have several children who are off the spectrum, and this is what we have learned is required from parents. First thing, an unconditional acceptance of your child the way the child is. Okay, what happens is we ourselves start thinking that a child is less than, that there is a child is not adequate, there's a problem. See, suppose your child had appendicitis, or he had a stone, or he had some lung problem, or even if he had a heart problem, would you think your child is less than? No, you would think you have a normal child who has a medical problem. Yes or no? Let's say your child had a hole in the heart. You don't think there is a problem with your child. You have a normal child who has a hole in the heart. Okay, you fix it. But when a child has autism or a child has cerebral palsy, we think there's a problem in the child. Now, so that's the first thing you have to change. Our children are different. They are not less than. I'm repeating it in reverse. Our children are not less than. They are different. Just like somebody can be tall and somebody can be short, somebody can be fair and somebody can be dark, somebody can have black eyes and somebody can have blue eyes. Some people have brains like us and some people have brains like our kids with autism. That is the only problem, and that is something which can be fixed. So the first thing we have learned is we have to accept our children the way they are. In no way be embarrassed or ashamed or look at them as less than. Be proud of what our children are accomplishing despite their limitations. Step one. Step two, what we have learned is the importance of family. Nobody talks about that. All right? What we have found is when the family works together as a solid unit, the children tend to do much better. Very often what we find is the entire burden comes onto the mothers. And here I'd like to address the fathers in the audience, if there are any fathers, that the father has a very important role to play. See, majority of kids with autism are boys. There's a 4:1 ratio. And as I'll address all the fathers. When we were small, who did we look up to? We looked up to our fathers for behavior, right? The mother was for love, affection, food and all that. We always looked up to our fathers. Kids with special needs also look up to their fathers. But unfortunately, fathers have to make a living, they have to work, they are outside and they are not able to spend enough time. What we have found is that when fathers spend time with autism boys, the kids recover much more and much faster. We've actually found that what it takes an autism father 1 hour to teach, it takes the mother 4 hours to teach the same thing. Not because the mother is not a good teacher, because the children learn faster from their father. So we have found that family is the single most important thing, and that kids whose families are supportive, when they work as a team, who wins a cricket match or a football match or a hockey match? The better team. And the family is also a team. And when the family works in sync, with the mother doing some things, the father doing some things, the other brothers and sisters doing others, grandparents have a very important role to play. In fact, we find that children who live with their grandparents tend to do a little better, because grandparents are also a big influence. Our Honorable former Prime Minister, grandparents have a very important, we've actually found this, that kids who stay in joint families with their grandparents tend to do overall better, because a grandfather's love and a grandmother's love and the teaching is different from, I'm not saying it's better or worse, it's just different. So family as a unit is extremely important, you know. So I spoke of unconditional acceptance, then I spoke of family working as a unit with fathers needing to give time. We do everything else. You supply your child with all the money and all the facilities, and you pay for everything. But what your child needs is your time. If you can just keep 2 or 3 hours aside every day for your child will do very, very well. Then what we have found is, from a medical point of view, if you take a combination of our cell therapy, hyperbaric oxygen, and rehabilitation, we find that this helps in getting the children to a normal life much faster. Now, what is the role of all of this? The brain is like a computer. A computer's got hardware and a computer's got software. Cell therapy fixes the hardware only. Software comes from rehabilitation, and software comes from the family, because that is what trains the brain. So a combination of cell therapy and oxygen therapy, which fixes the hardware, of rehabilitation and a good environment at home that fixes the software, and our children will be able to recover. So this is the next thing, the medical treatment. Then, apart from this, there is something very special we found. We found that almost all these children have some special ability or the other. Okay, but it was not seen till you did cell therapy, because now the brain was partially damaged, and so you could not see what is special. What we have found is, once we repair the damage in the brain with our cell therapy, now you can start seeing the special abilities. And we have kids we have kids who are brilliant in numbers. There are kids who are, running at the age of 11, running chemical factories. We've got, if I tell you some of the things, you'll not even believe them. We have a child who can actually read your mind after. A child who, after STEM therapy, has improved to the point that if you think of a number, the child can actually tell you what. And they are amazing ability. They're called savants. There are kids who you tell them any date in the future. Any date, you say 23rd July 2030, and they will tell you in an instant what day it is. It's Wednesday. And I don't know if you know, but Elon Musk, the world's richest man today, had autism. You can Google him. He talks about his autism. But this man changed the world. Albert Einstein had autism. Okay? But this man, and he could not read, he could not speak or read or write for very late in life. And then this man changed the world. Several of our tech geniuses, they don't have autism, but they've had difficulty in studying, learning, Bill Gates, Steve Jobs, they never graduated from college, all right? But these are people who changed the world. Leonardo da Vinci is believed to have had autism. So these are exceptionally gifted people. So the one thing that you have to do, see, you are talking about bringing your children to normal. I'm saying once you get, they do exceptional things. They do the most brilliant things. And that is proven by already. Look at Elon Musk. He talks about his autism. He doesn't hide it. He says he had this, but he changed the world. So we have to change our thinking. Instead of looking at what they can't do, we have to look at what is special about them. Like what our Honorable Prime Minister said by changing the name. He said, don't look at what they can't do. Look at what is the special gift in them. So with this combination of things, like I said, unconditional acceptance, the family working as a unit, the medically, a combination of cell therapy, hyperbaric, along with rehabilitation. And rehabilitation, like Dr. Nandini said, needs to be comprehensive. You need to be able to do all the rehab. You can't just do one. People think they go to just one specialty and my child will be okay. No. You need all the specialities together, comprehensive rehab, and then our children will be able to come out. So I hope that answered your question.
Yes, so maybe, wow, this is like a ray of new hope.
Yeah.
I'm sure all the parents here, some of them who might have lost hope, but with everything that you've explained, it's actually truly inspirational. So my question is, you've spoken about stem cell therapy, and I'm sure in the minds of many parents, they are wondering, wow, it's expensive going to India. Before even you think about how much the operation cost, you think about even the air ticket and the flight and accommodation and everything. So is there any plan to bring this in Africa?
Yes, so we are very clear. We want to have a facility set up in Africa, and we are actually keen on, so we've actually shortlisted between Tanzania and Kenya only because they are English speaking, direct connection to India. So to give you a background, for example, the government of the Bahamas actually invited us and gave us permission to start this, and we've just been there recently, and in 6 months we are going to open a full-fledged facility in the Bahamas. This is to cater to, the facility will be in Nassau, their capital, and there we have government permission. Just like again we have a former Prime Minister with us, there we have a former Prime Minister working with us, and we have government permission. Because we have government permission, we are setting up a facility there. We are very keen on making something available in Africa itself, and we would like to have it in Eastern Africa simply because of our closer cultural connections, easy, short distance of travel, direct flights and all that. And we have people like you, mothers like you who would back it up. So yes, we want to bring this to Africa, but it's not easy. It will require, permission right from the top, from governments. It will require infrastructure. It requires resources. But this is something which you as people, because the most powerful voice on the planet is that of a mother, is that of parents. When you speak out, honorable ministers, prime ministers and presidents have to listen, because we all democracies, they represent us. So your voice is what is important. Not us, we've come, we've shared our information, we can share our technology, but your voice is what is important. You have to ask for it. You have to show, show what's happening. Right now, there are so many people going from Africa outside for the treatment. It's high time Africa had its own stem cell facility, which would not be just for Tanzania or for Kenya or wherever, but for the whole continent. So people would not have to travel long distances. So we are very keen, we are willing to partner. But this is something which you people have to take the initiative. You have to, eventually it's all about people. It's your voice.
Thank you very much. I think we are coming to the end of this session. Mothers, you've heard, we have a great voice. Let's get together and advocate for this. Fathers, please support us. Don't abandon us. Be with us. This is a journey that we have to walk together. And there is hope that we can say bye to autism, but only if we put in our every energy to support these children, seek the available treatment options. I think we can say bye to autism for the most part. Thank you so much, our able doctors. I think you've given us a lot of hope. You've explained a lot. You've allayed our anxieties. I think now it's on us to follow what you've told us.
Thank you so much, Dr. Olivia. Thank you so much. I really appreciate the fact we have 3 mothers from 3 East African countries. Kenya, Tanzania and Uganda on this platform. So I think you represent all the mothers, not just of East Africa, but of all of Africa, all right? And if you take the initiative, trust me, believe me, the power of your voice is a force of nature. It cannot be ignored, okay? And a mother's voice does something. It reaches out to people. It touches people. And we've actually seen that in our country as well. When we had, different situations, when we had mothers speak up, everybody heard them. Okay, more than doctors speaking or hospital speaking. So I just want you to know the power that you have within, the same power and energy that you've used to bring about improvements in your kids, that could now be extended to all the kids of the continent. So it's been a real pleasure. And Dr. Nandini, sorry, you want to continue?
No, I just want to say thank you to the mothers. They've done a great job to represent all of us. Thank you, mothers.
Thank you. Thank you so much.
That was good. Before you go, you've done a great job. Thank you so much. I know there's a lot of people who wants to ask questions, but because of time, yes, there's a lot of hands. Because of time, I would like, because our minister, our deputy minister has a question, so can we please take the mic to him? At least we answer questions from him, and then we'll see if we have more time to invite more questions. Naomba makofi tena tafadhali. Karibu sana mheshimiwa.
I don't think it is a question, it's just good news perhaps. He said, I know Professor, he said about the PET-CT scan, if we have in the country. Yes, we have. It is in Ocean Road,
Okay.
our Cancer Institute. So actually last month they completed it to connect it so that it can start function. We expect this month it's starting to work.
Very good.
Yes, so we have that. So it's a good news to the parents when we are talking about PET-CT scan now we have in the country. Another thing is hyperbaric oxygen machine, you said. Yes, we have it in Muimbili. Yes, in 2 weeks it will start functioning. So, so we are working with the professor so that we can see, so that it can accommodate everything you want. You were saying if it can accommodate everything, but if not, we can make sure that it will accommodate. But we have those two things, then now we remain with issue of, yes, we are doing bone marrow transplant.
Yeah.
Please, perhaps the professor can explain a bit.
Thank you, Honorable. So just to add, to increase the insight, we are also doing a bone marrow transplantation.
Okay, very good.
In one center, we are doing autologous bone marrow transplantation.
Okay.
In another center, we are doing allogenic bone marrow transplantation for children with sickle cell. So I think that also opens the potential for doing stem cell transplant.
Absolutely.
Yeah.
So all the technology is there. We
Yes.
just need to put it together now. You know? That's great,
Yes.
wonderful news. Yeah.
Yes, that's what I'm trying. I just have to say that so that the parents can hear that.
Yeah.
You talk to many technology, then we can see how is our capacity by now, then we can move from there going forward. But something is going on. Thank you.
Thank you so much.
Okay, thank you so much, our dear Deputy Minister of Health, for the additions. And I would like to also, with due respect, call you, Honorable Deputy Minister, to come on stage and give these beautiful people something that we've prepared for them. So please, if you don't mind, kindly come on stage. The panel discussion was great. Thank you so much.
Thank you so much for watching the panel discussion of ICAN Tanzania 2023 presented by Autism Connect. So to give you a brief about Autism Connect is an association of parents and professionals formed to disseminate scientifically validated information about therapies and treatments for autism. To know more about autism, you can log on to our website, which is www.autismconnect.com. After 2 successful ICAN conferences, the first one being at Dubai and the second one being at Tanzania, we are now coming up with the ICAN conference at Canada, Niagara Falls. To know more about our conferences, you can log on to our website, which is www.icanconferences.com. Thank you so much.